Now, by the hour, we are getting reports of how countries running out of hospital beds, running out of oxygen, how there's simply no way the medical infrastructure can take any further load. And more people now advised to take care and home care their COVID. So how should you be tackling COVID at home? What is the best way for that home care for COVID? This is what we'll explain to you in this explainer. First up, who can be isolated at home? That's very important to remember. Well, two kinds of people. A, if you're asymptomatic, basically meaning you have very mild illness and your fever and your cough, etc. Symptoms basically are as follows. You have a sore throat, you have muscle pain, you can get nausea, diarrhea, loss of taste and smell, and more with the new variants around now, shortness of breath. In fact, if you don't have shortness of breath, that is when you are called a mild patient, and that's when you can actually home isolate. The other kind of people who can isolate at home and care for COVID at home are patients with moderate illnesses. For example, if you have evidence of lower respiratory disease during your imaging, this basically CT scan, etc., and your saturation level of oxygen is above 94%. So do remember, if you have shortness of breath, if your CT scan is showing increased patching in your lungs, that is the time you need to go to the hospital. Apart from that, you can treat it at home if you do it wisely. Now, for treating COVID at home, there is some equipment that you must always have. Two essentials over there, a thermometer and a pulse oximeter. Pulse oximeter is, all of us are aware of it right now. You can order it online or just get it from a nearest chemist. Both these should be reported, maintain a chart and take it at least twice every day. But what are some of the essentials over here? What are the things that you must do if you're treating COVID at home? First up, drink lots of fluids. Constantly wash your hands with soap and water. Triple layer mask and discard that every 8 hours after disinfection. Disinfect your frequently touched surfaces as well and avoid any daytime naps, etc., as it can lead to some sleeplessness at night. And keep your doctor's number at hand. Keep updating that chart I told you about. Keep sending it to them twice a day. Also, something that has turned out to be a huge help in COVID recovery is drinking lots of water, but also doing steam inhalation and warm water gargles as well. Now that you understand what are the things that you must do apart with the medication that your doctor gives you, some of the red flags, what are the things that you need to keep in mind, and when the following symptoms come, you must report your doctor, and perhaps that's the time you need hospitalization. First up, dip in oxygen level. If your oximeter says it's below 92% or so. If you have slurred speech, if you have weakness in your limbs, something that has gone up exponentially compared to the past few days, if you have difficulty in breathing, if you have pain or pressure in your chest, and if you see discoloration in your lips, face, sometimes in your nails and your fingers as well. Every time that happens, let your doctor know, let him decide what is to be done. And when, this is a most commonly asked question to us, self-isolation but living with other people. How do you do that? Well, for that, the best thing to do is have separate rooms, but also have separate bathrooms. And in the room that you are living in, there should be enough ventilation. Do not share vessels, even linen, and keep all these items segregated for the COVID positive patient. Do not let that mix up with other people in the house. And allot one person in the family who is going to be the caregiver, who will always have a double mask on or an N95, and that person, whenever catering to them, giving them food, etc., should maintain at least 1 meter of distance. So this is what are some of the tips that you can keep in mind if you're treating COVID at home.